Hi, my name is Jessica Altamara, and I am head of infant feeding for the North Carolina Tongue Tie Clinic in Cary, North Carolina. I also have a private practice in the same triangle area of North Carolina where I do mostly home visits. And what I want to show you today are tummy time waves. So we usually teach these in our integrative clinic when we use our group model, and I often teach this in home visits, and it serves some very specific purposes that I'm going to talk about. The first thing I want to talk about is where you're doing your tummy time waves. So if you have a spot that you can make your tummy time spot and that's going to work for you, that's great. Especially if you have an older baby that might be interested in toys, you can have a collection of them there. At the same time, we want this to feel like something you can do very casually, that you can do sprinkled throughout your day, and so multiple spaces can be helpful, or just understanding that you don't really need a special space to do a few tummy time waves when the opportunity comes up. Additionally, not everybody is going to be in a good place, especially right after giving birth, for getting up and down off of the floor. And so you also want to think about what makes this feel feasible for you and your own physical needs and comfort. It's better if this is something where you're doing this together with your baby. So we want to think about ways to be able to kind of get down and engage with them in all of the positions they're going to be in. If you're using a tummy time mat, many of them have other toys that go over the mat, and having those in place while doing tummy time waves may make it more difficult for you to get in and engage with your baby. So also think about those kind of adaptations. In this case, I have a fairly firm ottoman. It's in front of my couch. This often works well as one of the spaces for many families because it can be done in a way where people are already often sitting in this area. It can be sprinkled in between feedings. This can be done before feedings, halfway through feedings, or afterwards. A lot of people are worried about doing tummy time right after a baby eats, but it has actually been shown to help with reflux and to reduce spit up. So even though right after a feeding some babies might spit up a little bit, it's actually not a bad idea to do some tummy time right after a feeding, even if that happens, because it's been shown to have faster gastric emptying, less volume of spit up, and better absorption after feedings. So there's really not a time that's bad for doing tummy time waves. The idea of waves was first coined by Michelle Emanuel, who's an occupational therapist in Ohio, and she has a YouTube channel with more information about other exercises and ideas, and certainly variations on this are advocated for by many occupational therapists. And tummy time is often thought of something as a tool to kind of combat back to sleep, and that babies need to have good balance between being on their backs and being on their tummies and in other positions to ensure good symmetry of head turning and nice round heads. This does have these advantages, but specific for babies that are having feeding challenges, and especially before and after a tongue tie release, this incorporates other therapeutic ideas that I'm going to talk about with you that has added value for helping babies integrate change. Often in our integrative tongue tie clinic, I am talking about the idea that when we release a tongue tie, it's like a hardware change for a baby, and then we need their software to update, because it doesn't really matter how good the release is or how well it heals if a baby doesn't realize that their mouth has changed and actually start to change their function. The other thing that this can really help with is it helps babies build resilience and get better at kind of calming down after something stressful, which does start to play in when we're talking about soreness and feeding following a release, or the aftercare that's being done that can be irritating or uncomfortable for babies. So to get started with our waves, you're going to be focusing on connection. There's a concept where people are in the best place to integrate change and learn new skills when they feel both safe and connected. And there's a a lot of information on something called polyvagal theory, which I can put some links to, but the idea here is that your baby is going to be in the best place to practice these skills when you have connection and co-regulation with them. So we're going to start here in co-regulation. This can be core to core, heart to heart, in cuddle mode. Sometimes with older and more social babies, it might be kind of starting here, making eye contact, especially if you're doing a lot of other intraoral therapies or stretches or some version of wound management. You can also focus on just sort of touching your baby's face, running your finger along their gums, massaging the roof of their mouth, and other playful things. But this should feel connected and playful. And sometimes you might kind of have to bounce your baby a little and get them settled. Once you're feeling like they're in a place where they're connected and calm, then we're going to start our tummy time wave by putting them down on their backs. And we're going to kind of go butt first and do like a little bit of a roll. This often makes me think of my favorite yoga instructor who used to say, roll down bone by bone. And so while my baby doesn't really have an articulating back, your baby will be able to roll down like this. And this helps with core flexibility and just a little bit more articulation there. Now that my baby is on their back, I am going to help them settle into this position. So I might talk to them, I might continue doing silly things, and I might kind of help them stretch out by lifting their arms up like this and letting them do a big stretch until their legs start to kind of come out and mirror this. If my baby's having trouble settling onto this surface, then I might do a bit of rocking. So this kind of taking your baby's hips and rocking like this is often helpful in helping them settle down. And then doing a little bit of a rib jiggle like this can also be helpful, because that can help with startle reflex and things like that that make babies a little uncomfortable to be on their backs. So this kind of lifting them like this and jiggling, doing a little bit of a hip jiggle, talking to them, seeing if they'll turn their head, towards me and in different directions. In this position, I can start to notice if my baby has a head turning preference while on their back, or if there's one side of their body that they're not moving. I can notice if my baby has a tendency to kind of curl around to one side when they're on their backs, and then kind of work on symmetry of posture and movement in this position. Now, interestingly, often babies will have maybe one preference on their back and a different preference on their tummy. So you want to continue to be making observations throughout as far as the way we can increase greater movement throughout their body. There's actually a line of connective tissue that everybody has, and it starts right up here by the base of the tongue. It goes down through our trunk, wraps around our organs, and plants in our pelvic floor. And then it actually goes down the inside of both legs as well. And it's helpful to understand that we're connected in a literally visceral way through what's called your deep central line of fascia that can affect movement up here and go all the way down through. And so any movement and elongation, especially in the core and up in here, is going to help your baby have better tongue and jaw movement as they're moving forward with more range of motion, or even before that, when babies are working stuff out from being in the womb. Babies in the womb spend a lot of time in this position. So they're like this in the fetal position. But an optimal feeding position involves them being on your body. And this applies for bottle and breast. If you watch my therapeutic bottle feeding or biological bottle feeding video, you'll kind of see how these positions are often the same when we're being therapeutic with feeding. But we're looking for your baby to be able to do this a bit, since that's how we all drink. And I'm going to start here. I'm going to help my baby settle, maybe do a bit of rhythmic rocking, talk to them. And then I'm going to roll my baby onto his tummy. And when I do that, I am going to just use his hips, and I'm going to let him kind of work on what this feels like for him to do the rest, to find his body in space and to start to learn that movement. And then over time, you'll find that you have to help less and less, often with older babies that are used to tummy time, or just as more practice happens, you just even have to use their feet a little bit to do that. So I'm going to take my baby's hips and roll him onto his tummy. And some babies will face plant like this, but that's fine because we're right here. One of the things you might notice is that when my baby rolled in, his arm got stuck under him. So one of the therapeutic measures that we want to use when doing these tummy time waves is something called the zone of proximal development. And that's a therapeutic term that is based on the idea of just enough, that we only help as much as we have to, and we only help when we have to, because everybody learns skills by doing them. And we want to give our kids and our babies the opportunity to do as much of a skill themselves as possible, and to also have a bit of faith in their ability to work it out. So we're helping just a little bit, but also there's a lot of holding space. So I'm going to talk to my baby. I'm not immediately going to pull this arm out for him. And if he's really trying to get it out, then I might tilt him a little bit to kind of help him get it out. But the last step that I would take would be to pull it out for him, because I'm trying to kind of coach him through learning how to do all of these skills with first like social and emotional support and calming, and then slowly helping more and more if he's having trouble working it out himself. Our goal is generally to have babies get their arms up like this. And then another therapeutic concept that we're working on is moving between ease and effort. This is especially helpful for feeding, and particularly for babies that have or recently had tongue ties, because often babies that have poor stamina for drinking and removing milk will become a bit passive. And so they kind of receive milk and then check out, or just go into comfort sucking until more milk comes. And moving between ease and effort is important with feeding, where they go into effort and remove milk, and when they take a breathing break and go into ease, that they come back into effort to go back into removing milk, so that we can get more consolidated feedings, and that they can be efficient and start to build stamina. So we're going to work on moving between ease and effort with head lifting, head turning. I want my baby to lift his head and then rest. And some babies you'll have to really talk to them and call their name and get them to lift up and look. Other babies will lift their head and it's really hard to get them to put it back down. So we might kind of help them put it back down, or let their head rest on our hand and then slowly lower it. I'm going to try to be as social as possible, come down and make eye contact with my baby, touch him, call his name over here to get him turning. And often older siblings can be really helpful with this. They can get down on their tummies on the floor. They can move around and call the baby's name. This can definitely be a family activity. Often with preschoolers or early elementary school kids, I'll sort of say they're going to be the tummy time buddy, and they can help you remember to do tummy time if that's their special job to help out with. Some kids are going to be mature enough to do the rolling and everything, but most kids of most ages can help down here with teaching their sibling how to lift their head and be a snake, or just crawling around with them. So that's a helpful tip. The last thing that I'm looking for with my baby is this idea of this like peak of frustration or peak of excitability. And so I am going to give my baby a chance. If he's starting to get frustrated or uncomfortable, I'm going to give him a chance to work it out. I'm going to give him some pats, like rub him a little bit. If I want my baby to calm down, I'm going to do deep downward strokes. But if I want my baby to maybe wake up a bit, I can do quick upward strokes. And so this is stimulating and this is calming. And like these are things we can do. If a baby's already taking a pacifier, they can use it during tummy time if that's what it takes to get them to be willing to do it. But primarily, I'm going to let my baby work on things. I'm going to be as engaged as I have the bandwidth to be right then. And when it's clear that he's not going to work it out, when he's starting to escalate into frustration, he's not just kind of complaining and then calming and complaining and then calming, but really like approaching crying, then I'm going to roll back out. So I'll tuck his arm. You can tuck it up or down. You just basically don't want it straight out like this. I'm going to tuck his arm and roll him. And often when I get the baby here, I'll let go and let gravity finish. Sometimes babies startle when that happens, but that's okay. We actually want babies to do a fair bit of startling. That helps them integrate that reflex and stop doing it sooner. So it's not bad for babies to startle, but this is certainly a more convenient time for babies to work on that than when you're like trying to put them down to sleep or something like that. So now that my baby has kind of gotten frustrated, rolled back out, I'm going to bring him up and take a reset. And that might be here, it might be patting, it might be bouncing like this again. If I have to, I might sort of do a bit of this. But I'm going to get my baby to take a reset. And then as soon as he takes a reset, I'm going to try to do a second wave. And I'm going to put him down on his back, try to get him to settle. If he's more fussy on his back than his tummy, then I might roll more quickly, especially like a baby that has reflux and is uncomfortable on their back. And I'm going to use his hips. I'm going to roll him to his tummy in the opposite direction from the first time. So doing this twice in a row has a bunch of advantages. One is that you get to roll in each direction, and that symmetry of movement is important. The other is because we're working on like emotional resilience, getting uncomfortable, getting frustrated, starting to escalate, and then resetting through connection starts to build resilience. Our nervous systems have like they benefit from exercise kind of like our muscles, and so we get good at what we practice. When you have a baby that's kind of 0 to 60, then often they're good at up-regulating, but not down-regulating. And practicing down-regulating before they kind of hit this like lock-up of being super frustrated where they're sort of in fight or flight or close to it, we help them kind of learn how to get frustrated and then calm back down before they freak out. And get frustrated and calm back down before they freak out. And practicing that twice in a row starts to build resilience where babies will handle changes better. They handle change in flow with feeding better. They handle stretches and other oral therapy better because they're just better at kind of staying a bit engaged even if they're uncomfortable. And that's a big part of what we're practicing here. Because of that, in my second wave that I'm doing with my baby, I don't really care how long he's on his tummy. I care that we roll onto tummy, sort of practice moving between ease and effort as much as he will, start to escalate, and then roll back out again and come up for a reset. It doesn't matter how long babies are on their tummy. Our goal is actually to do as many waves as possible in a day, but to do them in even numbers, in sets of 2 or 4. And a wave is here, down, onto tummy, all the stuff we already talked about, back off of tummy, and here. That's one wave. So we try to do at least 2, rolling in each direction. Don't worry how long. I think it's great if you can get your baby to be, a minimum of 30 seconds on their tummy, but it's more important that we get the waves done. Our goal is to be doing like 16 to 20 waves a day. That sounds like a lot. But if you're doing them in sets of 2 to 4, that could be 4 waves 4 times a day. It also could be something that you're just working into your day, where every time you change your baby's diaper, you do a couple waves before or after on the changing table. Where if you sit down for a family meal, when everybody's sitting, you can kind of put your baby down, roll them to their tummy, and let them be part of the family meal where you're engaging and moving back and forth between holding them. Most babies are going to kind of reach that peak of excitability fairly quickly at first, but then as they get older and they get more comfortable with this, sometimes it might feel like it's going to take forever. So if you're finding that your baby just loves tummy time and it's consuming a lot of time to get in those number of waves because they're not getting frustrated, then you can kind of let them play on their own for a little while if they're older, or just roll in and out a few times and then kind of let them hang out. If your baby falls asleep while on their tummy, you want to stay in the room and awake. So we want to be supervising this, particularly with babies under about 4 months old. We just want to be around when they're on their tummies and If your baby falls asleep, just stay in the vicinity and awake. Keep an eye on them. That is why it can be helpful to make sure that where they're doing tummy time is what would otherwise be considered a safe sleep surface, which means it's firm and it's flat, that there aren't a lot of pillows around them. Sometimes people are trying to do tummy time with like props and things like this, where you might have something under your baby's chest. These kind of accommodations are fine, and it's preferable and the most therapeutic if your baby is flat on a firm flat surface and allowed to do this movement. You can also just try to make it your default for how you put your baby down during the day. Just whenever you're going to be putting them down, putting them on a flat, firm surface is best, and doing it on their tummy, especially if they're on their back all night long, just making your default way that you put your baby down whenever they're awake or during the day is their tummy. Then this starts to build in all of these waves. And even though you really start to reach the most therapeutic value when you get into those higher numbers, any waves, any day are going to have therapeutic value. The more you do, the more therapeutic it is. And so focus on doing the best you can. Understand that there is a lot of grace here, and that other therapeutic things as far as just holding space with your baby when they're frustrated, not like working to be an anchor for them when they're starting to escalate, stopping when they're frustrated and making eye contact, talking to them, mirroring their emotions and then bringing them back down. All of this is incredibly therapeutic and weaves a lot of these ideas in. And when these aren't happening organically, then these tummy time waves provide a structured opportunity for all of these therapeutic concepts that can benefit babies in their overall well-being and development, but are especially helpful before and after a tongue tie release, when babies are needing to integrate a lot of change, potentially deal with some muscle soreness as they change the way they're moving their tongue and their lip and their face, and can help with dealing with discomfort and stress without freaking out or shutting down. So give us your feedback. Post videos of your babies doing their tummy time waves. There's a lot of different ways to individualize this. The best way to know exactly the right way to do all of these things with your babies is to work with someone who's trained in all of these ideas and concepts, who can help you understand the individualized way to do this with your baby. And we're always happy to help find those connections for people. But starting with these waves, having these concepts, giving yourself permission to just hold space, listen to your baby, and be intuitive about what's working for them. Pause and make observations with them and about them, and also be aware of what's happening internally and what that's communicating to your baby as you move through your day together. These are all concepts that will help facilitate faster improvement with feeding, and also is great for preparing babies for having a tongue tie release. So really working for about 5 days before the tongue tie release to do a lot of these tummy time waves helps things go much more smoothly afterwards, in addition to a lot of the other prehab concepts in the other video. So just do your best, connect with your baby, and it's going to be therapeutic.